So if there's any clinicians within your practice in particular who are doing a lot of the discussion appointments for any of the respiratory conditions, then please do share this with them as well. The next thing I'm going to talk about is in my PNA capacity. So as the professional nurse advocate, I'm putting on an event for any nurses or any member of the nursing team who is considering or approaching that time where they're thinking about perhaps retiring as well. I'm inviting you all to come and join a group restorative clinical supervision session where you can come and meet other colleagues who may be in a similar position, thinking about retiring within the next few years and what the next steps could be. It gives you a little bit of a confidential space to discuss with other people who are going through the same things, reflect on your journey, reflect on where you've come from, and also explore options. Discuss whether or not there's anything you want to continue to do beyond retirement, or any other contribution you could do, such as mentoring or legacy mentoring or training up new nurses, anything like that, and to consider your future career paths as well. This is happening on Tuesday, the 3rd of June, and it's happening between 12:30 and 1:30. I'm really sorry if I know sometimes a Tuesday, doesn't suit absolutely everybody. So please do reach out to me. I'll put my email address in the chat. If this time doesn't suit, then please do just send me an email and we can always meet one-to-one for a chat around about a similar topic. Or if you need any support from the nurse advocate, then please reach out to me. And I've just put a QR code here if you want to sign up for that group session. And you can again access that session via the NCL Training Hub website as well. But I'll pop all these emails and things in the chat so you can contact me if this time doesn't suit. Thank you.
Thank you, Lisa. That's really, really helpful. Thank you for that information. Great. We've our next speaker is Camille. Camille's nursing ambassador for the NCL Training Hub, who's going to continue delivering the session on 6 C's. And today, Camille's going to be talking about courage and commitment and leadership. Over to you, Camille.
Good afternoon, everyone. Do forgive me. I'll be looking up and down because I'm on 2 screens, and also my computer is threatening to turn off again. So if you lose me, you shouldn't lose me. It's saying 59 minutes, so that's enough time. So you shouldn't lose me. But if you do, it's because the computer is switched off. It's restarting. So today, Barbara is going to move the slides along for me. And today we're talking about something that's really important. And thank you again for joining for the 6 C's. This is the second one. And today we're going to cover courage and commitment. And we're looking at general practice and leadership with courage and commitment. Can you move that slide, please, Barbara? So these are the learning outcomes. These are the things I'm hoping you'll take away from today. Can I ask as well, I was going to ask this before, can I ask that you just in the chat put what borough you work in so I can get a little flavor of where everyone's from. So we're going to try and understand what it means to be a leader. And there's different types of leaderships. And the one that we're mostly that's most important is how can you become a leader and how can you incorporate this into the 6 C's? This thing will not get off my screen. Thank you for those who are putting their borough in the chat. I appreciate it. So when you think about leadership, not only nursing leadership, but leadership in general practice in general, in the last few years, we've had an influx of lots of different people into general practice. So it's not just nurses and doctors anymore. We've got physios, we've got OTs sometimes who sit in general practice. We have pharmacists, PAs, and when you think of leadership, you think of something that is multifaceted because you will be called on to lead not only nurses or doctors, but also people from other allied health professionals as well. And The thing about leadership is it should always be positive. Leadership should never be negative. And there's a difference between being a leader and being a manager. And we will kind of just have a look at what the difference is or are differences are. And often when we consider leadership, we think about our manager who has certain skills, who has certain responsibilities. But when we think about a leader, it's not only about the skills that the person possesses, it's their ability to take us from one place to the next. It's their ability to get us from point A to point B in one piece, functioning and being able to develop ideas and concepts and behaviors that will help us to function at the higher order of Maslow or hierarchy. So, in other words, the difference between being a leader and being a manager is that managers set out goals, but leaders help you to meet those goals. Can I get the next slide, please? So, it's all about sharing one's vision. It's all about sharing one's vision. Now, the NMC, when you talk about leadership or think about leadership, the NMC has 4 pillars for nursing leadership. And if you look at the picture on the screen, it talks about clinical, research, education, and leadership. Yes, this is mainly for advanced nurse practice in terms of the research, but all nurses do things like clinical. We also do research because we're part of research. I don't know if anyone's been a part of the immunization research that just went the other day. And we educate and we lead. I want us to pick up in further on in the slide. I'm going to pick up on education because there's something that we're promoting in NCL. I don't know if you guys have heard of the Legacy Nurse Mentor, and we're promoting that in NCL. And it's all about educating each other and also educating ourselves too. So the pillars of leadership is looking at being proficient in whatever it is that you're doing in your everyday job. You need to be proficient and you need to work as part of a team. You need to have the appropriate level of understanding and skills to carry out your career. And also, we need to be able to fulfill management responsibilities, not only leadership. Next slide, please, Barbara. I'm going to let you have a look at this slide. I want you to pay attention to the numbers. 19%, 17%, 23%. And this is looking at effective leadership in healthcare, and it's quantifying how important leadership is in healthcare. If you have effective leadership, 90%, excuse me, there's a 19% higher patient satisfaction rate. So the patients are happy when we have good leadership. Also, staff are happy. Look at that 17% retention. And we know in general practice, sometimes we can have a high turnover. So 17% retention of staff is excellent. And as leaders, we're not only thinking about clinical staff, we're also thinking about our admin staff who are instrumental in helping us carrying out our duties and responsibilities on a daily basis. So if you look, 23% improvement in clinical outcomes across the matrix. So when we have good, competent leaders in practice, that means our job will be easier and we will appreciate going into that job every day. At the bottom here, it says that the NHS organization that correlates this talks about developing a sophisticated approach to leadership. And sometimes with nurses or maybe other AHPs, we're not sure, but mostly with nurses, sometimes we find it difficult to put ourselves forward to lead. But never forget that when we become leaders, we also become nurses who are patient-centered and patient-focused. And not only patient-centered, but also we support our colleagues when we embrace leadership. Thank you, Barbara. Next slide, please. So there's 7 main types of leadership in nursing. Of course, we don't have time to go through all of them, but I've just listed them here for you. There's up to about 10 different types of leadership, but this is the 7 that we usually use in nursing, or maybe in the NHS if we think about it on a wider basis. So I'm going to choose the 3 most important to discuss on my next slide, but Barbara's going to now show you a video. This video is an American-based video, but it's quite interesting and instrumental because we're trying to get all nurses to be educators. And what you'll find is that this video talks a lot about transforming nursing and fostering leadership in nursing.
Sorry. If someone's
Can
unmuted,
you
if you could
mute your
just
mic,
mute.
please? Thank you.
Thank
I'm
you.
going to mute my mic, Barbara, and you can go ahead.
Thank you.
Good morning. No, if anyone asks if I come on time, I will.
Leadership is important in every aspect of being a nurse, from a new graduate all the way through a nurse executive.
I think the best nurse leaders are those that span boundaries.
You naturally want to do something to help others, and putting yourself forward is really just part of that process.
To get out of your comfort zone, you just have to take the risk.
Mentorship is so critical. It is a critical piece of this leadership campaign.
The Institute of Medicine, in its landmark 2010 report, The Future of Nursing, Leading Change, Advancing Health, deemed leadership so important it is one of the report's 4 key messages and 2 of the recommendations: to expand opportunities for nurses to lead and diffuse collaborative improvement efforts, and to prepare and enable nurses to lead change to advance health.
To me, being a nurse leader is being a voice for the community. I think it's really about bringing others to the table with you. It's serving as a mentor to someone else so that they can rise and become a leader.
Nurses, bring a perspective from the patient, but also work with physicians and other members of the healthcare team to make changes that will impact patients in the hospital, outside in the communities.
They are energetic, rising nurse leaders with strong vision.
The Campaign for Action, created to implement the IOM recommendations, has turned a spotlight on nurse leadership. In 2014, the campaign named 10 breakthrough leaders in nursing to help transform the nation's healthcare system, create healthier communities, and build a culture of health.
I helped create the first nurse manager job share in North Carolina at my institution because I wanted to work. I had small children, so did my job share partner, and so we did the first job share in nursing.
My life took me in many different directions where I got to learn lots of skills, kind of practice some things out, and then gather it all back up and move back home and follow my dream and help to provide services to women who otherwise wouldn't have had them.
Leadership is about stepping outside of your comfort zone.
Well, I think you have to push yourself to be uncomfortable. I mean, that's how you learn. So if you're just doing the things that you're really good at, you're not learning and changing and growing.
I decided to go for an opening as a night supervisor, knowing that I had little chance to get the position because I was only 18 months into my nursing career. So it was a surprise when I was actually chosen for the position.
Leadership is about mentoring.
There are mentors that are formal, and there are some maybe that are even informal, and then there are some that seek you out instead of you seeking them out. But it's such an amazing part of our profession to mentor one another.
If you see someone that you want to emulate, you see someone that makes you have a wow factor, ask the person to mentor you.
And leadership means being at the table when policy decisions are made.
We must make sure that we are not just knocking at the door and hoping someone will open the door. We need to knock the door down.
To address the IOM statement that, quote, leadership is fundamental to advancing the profession, 20 nursing organizations have formed the Nurses on Boards Coalition to put 10,000 nurses on boards by 2020.
We can care very deeply about making things better for people through systems, through policies, but if we're not connected to the places where those decisions are made, then it's more a goal, a desire, a hope. We want more than hope. We want serious action.
To be a nurse means to be a leader. Nurses work to build healthier communities and oversee complex healthcare for people in hospitals, in their homes, in long-term residential settings, in schools, and wherever they live, work, play, and worship.
I'm on a school advisory board, and I approached it, and they said they needed a person in charge of strategic planning, and I said I can do that, and they were surprised. I said, well, hospitals, organizations, that's what we do.
Sometimes it's just showing up, whether it's an association, a larger organization, a committee, a board, what have you. Showing up is half the battle.
Pathways to leadership are many, through community organizations, the PTA, neighborhood groups, nonprofit agencies, and in your workplace. Joining a committee and then leading it can be the first step to getting on a board of directors and making policy decisions about healthcare.
Find the things that you're passionate about. Find the things that you love. Those are the things that you'll shine at, because your heart will be in it.
Nurses, some 3 million strong and the most trusted healthcare profession in the country, are passionate about their profession and dedicated to helping others. The message from the IOM and the Campaign for Action is that nurses need to be just as dedicated and passionate about taking roles in making policy.
We can't get any of this done without nurses stepping up to the plate and being those leaders that we need.
As Florence Nightingale said, to be in charge is certainly not only to carry out the proper measures yourself, but to see that everyone else does so too.
Oh, thank you, Barbara. Okay, that was quite inspiring. That was very, very inspiring. What I like is this video is asking you to think about yourself as a nurse. Think about all the skills that you have that you don't know you have. That you've got organizational skills. Think about a job that you would like to do, but you think you might not be qualified. There was a nurse in that video. She said she was only qualified for 18 months, but she applied for a job that seems to be outside of her remit. But there's always someone who would love to give you a chance to elevate yourself, to become better, to become that leader that's inside you. Another thing that I took from that video is the importance of mentorship and mentoring. So the importance of being a mentor and the importance of being a mentee. So you will fulfill both of those roles. You might apply for a new job like I just did. I've never worked in workforce. I didn't know what it's about, and I'm being mentored by my team. And then you could be the person who will mentor someone else. So when we wrap up today, I want you to spend this weekend, this bank holiday weekend, thinking, how can I be a leader? How can I be better? Thank you, Barbara. Next slide, please. So we're going to talk about 3 distinct types of leaderships that we use in nursing. We're going to look at autocratic first. Now, sometimes not all leaders are made equal, and sometimes what you find is that you might need to use many different types of leaderships, not just any one. But there might be one that you prefer, one that you've chosen, but no type of leadership is perfect. So there's benefits and there's also limitations. So autocratic leader is the person who's hands-on. Think about your practice. Think about the nurses that you work with, and that nurse that just loves her clinical skills, love to probably do a dressing or do an immunization clinic. So that person is good at making decisions without the input of others. That person probably works well under pressure. So the benefits, of course, there's always benefits and there's also limitations. Autocratic leaders can be very effective in making decisions. So there's a wound. Does this need bandaging? Will this wound do well with a 3-layered bandage, 2 layers? Or this person is new has just come out of hospital, what sort of dressing will I use? And that's an autocratic leadership style where you're making the decisions. So these decisions are made from the top. So you've written a care plan for this patient. This patient needs A, B, and C, and then everybody else follows that. However, the drawback with autocratic leadership is that it can stifle collaboration. So it might not be appropriate in all areas because there's not the chance for your team members to collaborate and make decisions with you. Sometimes there's no transparency as well. But as I say, it works well in other areas, in some areas, sorry. Next slide, please, Barbara. Next slide, please, Barbara.
Oh, it's moved. Has it not moved for you, Camille?
No, but has it moved for everyone?
Can everyone see transformational leadership?
Yep, we can see it. Okay, that's fine then. So this is the one that all my students love, transformational leaders, because everyone wants to be a transformational leader. And this is really good because you empower others to be great. So you're great and you're going to empower your team to be just as great or even greater than you are. So students absolutely love transformational leaders. And these leaders tend to be exemplary. They get a role to do and they carry out that role and they bring their team with them. So the benefit is that these people are inspiring. So you might meet someone who inspires you to do something different. You know, you might meet a nurse who is working like Sal's working, and you're like, you know what? I'm really impressed by this and I want to be a part of that. So that would be a transformational nurse. They are good at setting goals and achieving these goals with their team. However, there's always weaknesses. And some of the challenges is that while a transformational leader can be inspiring, they can also be ineffective in some areas and some organizations. So it depends on where they're working. I think general practice is a really fantastic place to be transformational. Barbara, the slides are moving up and down. Is it moving up and down for everyone? It's just me.
Yeah, sorry, I was gonna I stopped sharing and reshare just because it might not have moved on for everyone, but hopefully this has done the trick.
Thank you so much. Yes.
If not, if
So,
anyone can put in the chat if you're having issues.
so in terms of transformational leadership, the style works best in environments where there's an established work structure. So places like general practice where we know that, you know, we've got our clinics booked, we know what patients we're going to see, we have our quaff to meet, we know exactly what we're doing, and this sort of leadership works absolutely well in this area. Can we move the slide again, Barbara? Now I am thinking, did it move for everyone? I think it did. It moved for me, so it should have moved for everyone. So a democratic leader. So democratic leader is a person who, or a leader who encourage everyone to have an input. So they value relationships with their team, they value relationships with the stakeholders, and they are comfortable and willing to listen to your concern and your opinions and your ideas. You know, these are the people who will say, so Camille, what do you think about this? You know, and you're able to give your ideas, your concepts, and your thoughts. Democratic leaders see value in providing feedback from their team, and also they're very good at two-way communication. So they say something, you say something, and then you all agree on it. This can be quite a beneficial type of leadership because it allows people to speak up. One of the things nurses always complain about is that they have no voice. When you have a democratic leader will allow you to have a voice. And they work well in organizations because they can be quite transparent, and they can help people to mobilize others to become the best version of themselves, so to speak. Of course, there's always limitations to leadership. So a democratic leadership style can be detrimental. You can imagine if you're in clinic and you're given an immunization and there's an anaphylactic reaction, then a democratic leadership style might not be appropriate because in that given moment, you're not asking others, what do you think I should do? Do you think we should do 5 mils or 10 mils or maybe 0.5? You know exactly what you do and you're going to follow those orders. You might need somebody who's in charge. So democratic leadership style might not work well for emergencies. So those are the 3 leadership styles. So we've got democratic, autocratic, and also we have transformational. I don't know, I want you to just take a second to think about what sort of leaders you have in practice. So you think about your place of work and think about the different leaders and think about the type of leader that you are. And think about taking the best bits from each leadership and making yourself into the leader that nursing needs. Remember that there's always drawback, there's always negatives. Nothing's going to be 100% positive. So let us see how we can think about leadership and think about the 6 C's where we're looking at courage and commitment. Next slide, please, Barbara. Now, we all know about the 6 C's. We spoke about all 6 in my last slide, so you can go back on that slide and have a look. So we know that it's about values that health and social care professionals are to implement in their everyday practice. So 2 of the 6 C's that we're going to talk about today is courage and commitment. And it's about how we create let's think about firstly the essence of leadership and what we would like from a leader. A courageous and committed leader, they are essential for delivering healthcare. They're essential for everyday care that we offer patients. So we must be committed to the job and we must be courageous in carrying out our job because that's the only way to drive positive change in the healthcare system. So creating a culture of courage, these leaders can foster a culture where staff feel safe and encouraged to speak up. So we're thinking about our democratic leadership here. We want to drive change. So in terms of courage and commitment, it's essential that we drive positive change. So positive change could look like we don't have a high uptake on our immunizations. We know that measles, we've got an outbreak of measles at the moment. So let's see if we can call patients in and get their children to be immunized against measles. And they must be trustworthy. So we must build trust not only with our team members, but with our stakeholders, our outside stakeholders, and also with the patients. And all of this will improve patient care. And it's really crucial for improving patient care. Next slide, please, Barbara. Can you guys just have a look on the courage in leadership? It talks about speaking up, innovation, taking risks, and protecting our patients. So in terms of taking risk, I would point out taking risk because it's quite an interesting one because it involves key parts of leadership such as decision making. And you might make a decision that's not popular. The staff might think that's not the right decision, but you know that that's the right decision that you need to make. And that's an autocratic leadership style there, where you're making a decision and that decision needs to move all the way down just so that so basically this decision might not be popular, but it's necessary and it's a positive change. In commitment in leadership, we talk about dedication to the patients and our population, putting patients first, ongoing learning and development, and leading by example. Now, I'm going to look at the last 2, ongoing learning and development. What do you think Why do you think this is important? Ongoing learning and development. Can anybody say why they think that might be very important? Just think about it for a minute and think about your clinical practice and think about why it's important for you to develop yourself.
Got
To keep
some.
up to date for best practice, correct you did. Best practice is key. So remember, everything we do, we update our knowledge, and we update our knowledge because best practice is very, very important, and we lead by example. So committed leaders are constantly seeking ways to improve their skills and knowledge. That means that you go on NCL and you look for a course now, and Lisa's doing the respiratory course. So you think, you know what, I haven't had a respiratory update in 2 years. A part of being a leader is learning and development. Let me go on this course. And it might just be that there's one thing that you've taken away and it's one important thing. And then when we're leading by example, we are demonstrating our dedication not only to the job, because sometimes you can be tired, you might not get on with your coworker, or the manager might say something and you don't feel as committed as you should. But you are committed in terms of you give your best to your patients and you demonstrate your dedication through your actions and your behaviors. Thank you for all who put their answer in the chat. Next slide, please, Barbara.
We have Salone's got her hand up. I'm
Oh,
not sure if
sorry,
she has a question on
Salone.
this.
No problem. Just before we move on, it's just a question really, Camille. Just, you know, we go to these updates, we've agreed that it's best practice for update our skills and knowledge. How do we empower ourselves, or what can we do that we share this knowledge? Because it's all well us staying up to date, but if we're leading and we're leading by example, it's important that we share this knowledge as well. And just wondered if you or anyone in the group really have tips, because I know we're all sort of busy. I haven't got time to, you know, just some ideas really. How do we share this?
I'll give you my answer, and if anyone in the on the meeting would like to give an answer. So one of the things I like to do is when I go on updates, like I went on the immunization updates and I went on it about a month ago, and I disseminated the slides to the members of my team. I send it to them to say, you know, this is what, oh, did you see this on the immunization update, you know? Or even sometimes it might be that we're all getting coffee in the break room and I say, do you know there's an immunization update? Have you booked yourself on? So that's how I tend to disseminate the information, and quite informally sometimes because we can be quite busy, but also it can be at the nurses meeting that you might have. Anybody else has any way of disseminating information?
I had an idea. So platforms such as this one, the forums, an example is next month we have Asha Palmer, who I believe is based in Islington, coming to speak on an agenda topic of shared learning in regards to the work she's been doing around the NCL toolkit for primary care cervical cancer screening, vaccinations campaign. And Asha reached out to us. So yeah, platforms such as this are key, and you know, making that kind of connection and asking if you're able to kind of have a space to share your learning.
Thank you, Barbara. And actually, just piggyback on that, I'm very happy that she's reached out, because what that will do is that will whet your appetite for research, because she did some research and that will whet your appetite, and you'll see how important research is in leadership. Lisa, you've got your hand up.
Yeah, so I suppose I just want to sort of reiterate what Barbara said, and also sort of trying to plug the PNA thing as my PNA role as well. But we do have, you know, forums every month for the nurse associates to come together, for the ANPs to come together. and for the nurse leaders. So any leader within practices in the nursing team at all can come together once a month. And that's a really, really good safe space for us to share learning and find out what's happening in different boroughs and how things are working in different practices, and build relationships with other nurses as well. So just to make you all aware that those group sessions do happen, and it is a really good way of us sharing learning in that space as well. I just wanted to touch as well, going back to the session I said about the retirement session for the group historical clinical supervision. And I touched on this a little bit when I spoke about it, but I think this is really relevant when you talk about us sharing our knowledge and sort of sharing our experience as well. And, you know, we know that across NCL there are lots of nurses who are approaching retirement, and it would be such a shame for them to retire and not for us not to sort of really capture that knowledge and understanding and share that as well. So important in these spaces as well.
Thank you so much, Lisa. That is riveting. Thank you. Fiona, you wanted to say something?
Oh, it was just more on a like a practice level. We used to have a meeting, as everyone does, I'm sure, every month, and just we had a thing where you just almost had to begin with had to bring something that you'd learned that month that you didn't know, and there's over time that kind of fostered a bit of a, you could almost say something daft that you didn't know the month before, and it encouraged a bit of co-learning, because usually it's not just you that didn't know something, is it? So
Thank you, Fiona. So we can see there that learning can be formal and informal. So we can get the information and we can disseminate it to our team, and that's informal, or the team can attend meetings and that's formal. Well done to everyone. Thanks for answering. Next slide, please, Barbara. Now, how do we become a leader in practice? I was telling I've started a new job in Enfield, and the nurse, this is his first nursing post, and I was saying to him, when I became a practice nurse at the ripe old age of 25, the older ladies and gentlemen used to come in and they go, oh, but I don't want to see you. You don't know what you're doing. I guess to them, I probably looked 18. So they thought that I didn't have any expertise. I didn't know what I was doing. How dare this child try and help us with our hypertension and our diabetes and all these different things. And I was telling him that because he was hesitant to apply for the mentoring. So we have something called Legacy Nurse Mentor, and he was hesitant to apply. And I was saying, you know, if it wasn't for the older nurses that I met at nursing forums who really took me under their wings and taught me and, you know, tell me not to worry, everything will be fine, I might have left general practice. So how do we become effective leaders? So say that, all of that to say, what he needs is an effective leader in his practice to teach him how to become a leader as well. So we think about our career. So general practice is not a place anymore that you go to retire. It's now a place that you go to have a blooming, blossoming career. So you can start off in general practice as the HCA. Before I say the HCA, so I've worked in 3 places where the ADONs, the director of nursing, have said to me they started off as a cleaner. One started off as a cleaner in general practice, one started off as a cleaner in theatres, and one started off as a cleaner on the wards. So before you become an HCA, you could be the cleaner in the surgery, and you think, you know what, I kind of like what the HCA does. And then you contact Sal or Barbara or myself or Lisa, and you say, I want to do a course. And then you become an HCA. And from an HCA, you can develop into a nursing associate. And then from a nursing associate, you can develop into a GPN, and then AMP, ACP, all these, you can become a leader, and then you can become a nurse partner if there's a partnership available. So you don't have to leave general practice to grow and become better. You can stay in general practice and you can learn all the skills that you need for your whole nursing career. In terms of teaching and mentoring, this is taken from the NMC, and the NMC says all nurses are teachers and leaders. The NMC then says it seeks assurance that those who support, supervise, and assess students are suitably qualified, prepared, and have the skill to do so. So at NCL, we have training. So there's the SSA training to help you to do that. There's also the clinical, I think there's a PG cert in clinical education to help you to do that. There is you might think, you know what, I need some mentoring in teaching and education. Is there any nurse in NCL that could mentor me to become a better teacher or a better educator? And also, I really want to plug the Legacy Nurse Mentor because I think it's a fantastic way to hone in on your skills, and also for the nurses with the skills, as Lisa says, don't retire and take those skills with you. Please leave it with someone because that person will also pass it on to someone else. And in terms of teaching, then when you do your clinical education PG cert, you'll be able to do a plethora of teaching and education. And this might see you take your career elsewhere to teach and educate other nurses. So NCL provides a culture of learning, and we are ethical, we're open, we're honest, and we're conducive to safe and effective practice and learning areas. And I want you to take that away. You are thinking, I want to become a leader in my area. And think of us, because we're here to help you to be the better version of yourself in terms of leadership and in terms of teaching and mentoring. Thank you, Barbara. Can you move the slide along? Before we go into our little case study here, is there any questions? You can either put the question in the chat. I'm in the chat at the moment, or you can put your hand up and ask a question. I'll give you a minute to do so. Saloni, thank you.
Sorry, I've got a couple of questions. I don't want to take up the forum with my questions. But I was just wondering, as a group, do we feel empowered to seek leadership opportunities where we are? I think it's all well that we might want to, or we might feel that this is great. I can see, but I'm just thinking, how do we seek leadership opportunities? How do we think that this is a good place for me, or this is something I want to do, and I don't want to retire, I don't want to move away from practice nursing without leaving a bit of a legacy, a bit of succession planning? And do I have the opportunities where I am? Because the way I'm thinking of it, there are opportunities everywhere. It's just that do we feel that we can seek them, or are we able to seek those opportunities? For example, the GP and academic program, we might well be assessed as there might be a gap of a practice nurse, for example, within your practice. Or do we feel empowered to sort of say, actually, this is a great opportunity? Can we engage with the training hub? Can we engage with the colleagues? Can we see if there's a way of bringing in practice nurses into the practice or the PCN? Thanks.
Thanks, Sal. Good question. I was just putting that in the chat. Excellent question. Thank you for asking that. Someone's put their hand up. I think I'm not able to see it. Could you just ask your question and say if you've got something to say? Have you put your hand down?
Yeah, I think the hand's gone back down.
Okay.
That's fine, and I guess that's something for us to maybe take away and say, how can we feel empowered? Are there opportunities? Maybe we can see how we can address that. And it's something for us to take away. Thanks.
Thank you, Sal. I can give an example, but just to think about confidentiality, I won't share. But there's a nurse who is retiring, and there's a nurse in her surgery who is a younger nurse, and she has encouraged that nurse to do the training. I'm not going to say what, because it might give away who the person is. So they've gone off to do the formal training at university, and then this older nurse who's retiring is going to mentor that nurse and teach her all she knows about that long-term condition. So that's one of the ways that you can do it. You can see a younger member of staff, and you can help with mentoring. Thank you. Lisa, you've got something to say?
Yeah, I just wanted to say a really good opportunity to discuss like sort of career pathways when we have our appraisals in our practice, and discussing with our managers, you know, what is the future, what career pathway could I take? Because it could be that perhaps a lot of practice managers don't know what opportunities are out there as well, and you can work together with your practice manager and your partners in your practice. I had a really inspirational person yesterday that I spoke to who's actually a nurse and has become a partner in her practice. And it's absolutely fantastic that that's come, and that's come through a lot of hard work and discussions and building relationships with her practice as well. So really the world is our oyster in nurses, and I've put a little link in the chat to a forum which Paul Vaughan, who is the Deputy Director of Primary Care Nursing for NHS England just now, well, it's NHS England, that he did to talk about the importance of leadership in nursing, and gives lots of examples of nurses who have done quality improvement projects within their practice. It doesn't need to be, not every nurse wants to sort of do sort of train other members of the team and things. It can be something that you can do in your practice as well. So yeah, I just wanted to say, use your sort of use that appraisal time to sort of speak to your managers and see, you know, what are the next steps and what could the practice support you to do as well. Because another thing that comes out as well is that sometimes you can be in a practice that maybe doesn't support you to take the next steps as well, and actually challenging that and sort of coming up with a bit of a plan for, like everything you've discussed there, Camille, retention and job satisfaction. It's really important your practice supports you to have that bit of career progression as well.
Thank you so much, Lisa. And Denise, do you wanted to say something?
Yes, I do. Can you hear me?
We can.
Yeah. So I work at the Bruce Grove surgery, and I find it really isolating. Just trying to meet other nurses, you know, just, you know, trying to have that kind of communication, like, you know, that kind of support. Also, I did apply for some funding for my pit stop course, and I've applied for it for maybe more than 2 months now, but I've not really heard anything from anyone. I must say, though, I've applied for the mentorship for, you know, the legacy nurse mentorship, and I have heard back from that nurse. So it's just for me to respond now to her, which I think is really great idea, because, you know, I'd say I'm like about 50% in my asthma COPD knowledge, and just having that support will just get me to where I need to be. So those are my current issues that I'm experiencing.
Thank you so much, Denise. I think Lisa, Lisa, would you like to meet with Denise? Oh, wonderful. You put your email in the chat. Fantastic.
Yeah,
So
Denise,
Lisa's here to help, and that's one of her roles.
Hi,
so
Lisa.
If you could just send her a
Hi,
message
Denise.
and she'll reach out to you, okay?
Yes, thank you so much.
Please do, Denise. You're not alone. Like that's exactly what I'm here for. And yeah, let's meet and chat. Yeah.
Yeah, thank you so much.
It's good to
I feel
talk,
like
right,
I'm out the
Denise?
wilderness now.
I'm happy that you've joined us then. Very, very happy you've joined us. Now we only
Okay.
have 4 minutes remaining. We could use those 4 minutes to, you know, ask questions. I think it might be worth asking a few questions if you've got questions, and then you can look at the scenarios independently on your own. So would you like to ask, you know, Denise has got an answer to her question. Anybody else has anything that they'd like an answer to? I've got a question for Denise, actually. Did somebody put their hand up? Sorry, let me just go and look in the chat. No. Denise, did you apply for, you said you applied for the Legacy Nurse Mentor?
I did, and I heard someone's responded to me, which, yeah, she has responded to me. So it's just for me to reply to that email. I'm going to do it today, and we need to like come to an agreement to a time where we can discuss and arrange that meeting. But it's just in terms of my other developments. I just feel alone. I just feel like I'm in this wilderness all by myself.
No,
it.
you're not by yourself. We're here to help. That's why we're here. And Lisa, you wanted to say something?
Yeah, sorry again. I feel like I've not stopped talking. Denise, I just want to. This is a prime example. You know, whenever we have a nurse new to practice, I want part of the induction for that nurse, for the practice manager, to give the PNA details for support for that nurse. And I would love every nurse in this forum to make sure, you know, whether you're still with your practice, that you have as part of your induction pack, you know, contact for support available for any new nurse that starts at all. Because it's really, Denise, I've been there. I was in my practice for years and years and years alone.
Can you mute your mics, please?
I was in my practice for years and years and years alone, and I completely and utterly understand that isolation that you feel. But there's no excuse for it now. You know, you should be able to be put in contact with people that can support you. And no new nurses to general practice in North Central London should ever feel that way. So please encourage your practice managers to know about the PNA service, to know about these nurse forums and things as well. Okay.
Thank you, Lisa.
Thank you
Sal,
so much, Lisa.
Oh, Sal, can we take Fiona before we take you, if you don't mind? I'm sorry.
Sorry, Sal. No, I was just going to add on to that, Denise, just to say, I think something so peculiar to practice nursing, isn't it? You're working secondary care, but in practice nursing, you're often one, maybe two more if you're lucky, and sat there on your own. And just, I'm sure you know, but you know, WhatsApp groups and stuff like that. Are you on all of those as well?
Don't think I'm on the WhatsApp group for this North Central London. No, I'm not. I don't even know the number.
Is the one for, what's the one that I'm on, Lisa? Is, because I'm fairly new to Islington as well. Is that the Islington one?
So yeah, all boroughs have their own WhatsApp group. So Denise, what borough are you in?
I'm in Haringey.
Haringey. I think I might have admin in that. So when you email me, Denise,
Yeah.
if you could send me your number, then I can add you onto that WhatsApp group.
I will. Much
thank
appreciated.
you.
Thank you so much.
Sal, go ahead.
I'm sure loads of us as well are happy to be in touch, just as other nurses.
Yes,
So,
definitely,
Yeah.
definitely. So we've got no minutes left, so we will take Sal before we wrap up.
No, mine was exactly that. Sorry to be a bearer, but we're running out of time, and I know Barbara wants to do her evaluation. Barbara, did you want to take the last minute, or I know people probably need to leave?
No, I guess it's just a slide that I'll show as people are leaving, if they're able to submit some sort of feedback. So if you want to go ahead, Saloni, with what you wanted to say, and I'll just put the slide up.
No, that was it. That was all I wanted to say, that we're kind of running out of time, but it's just been such a lovely session. And yeah, sorry to close it really, but it is 2:00, and do take a couple of seconds, please, everyone, to give your evaluation and feedback. And yeah, we can share the slides and you can have a look at those case studies in your own time. And then we're going to see you in a month's time.
Yeah.
So thank you everyone. Thank you, Camille, for that amazing presentation and really sort of food for thought. Thank you so much.
Thank you.
Thank you.